Hello.
Hello,
Hi, what's your name?
I'm Jess.
Hi Jess, my name's Tim. So what's happening with you today?
Tim, I was wanting to go and hang my washing out, and I was bending over in the washing machine,
Yeah.
going to the washing machine, and I just felt unwell and blacked out.
Okay.
Yeah.
And so do you remember everything that happened?
No.
Okay.
I think I was out for maybe 2 to 5 minutes. I can't actually remember how long.
Rightio. Okay.
Yeah.
So you were out for about 2 minutes.
Yeah.
What's the last thing you remember?
Bending over to get the washing out.
Okay. And then you woke up on the ground?
Yeah, woke up on the ground.
Were you face down or were you face up? Or were you laying on your side?
I was on my side.
Okay. Alright. And when you woke up, what was the first thing that you felt?
I just felt really giddy.
Okay,
Yeah.
alright. And how do you feel right now?
I feel okay.
Okay.
Yeah.
Alright,
I feel okay. I just slightly dizzy, nothing bad though.
Okay. Have you got any pain anywhere in your body?
No, no pain at all.
Alright. Any headache?
Yes, I have a headache.
Okay, alright. And any blurred vision or anything like that at this stage?
No.
Okay, alright, excellent. I'm just going to have a feel on the back of your neck here, mate. Just because you did have a fall and you blacked out. Do you have any pain in the back of your spine?
No, I don't.
Any pain down your back at all?
No.
Alright, I'm just going to keep feeling. Just let me know if you've got any pain at all on your back.
Nothing at all.
Alright, very good. Any pain in the back of your head?
No.
Okay. And just clench your teeth for me, alright? And no pain in the side of your head there at all when you clench your teeth? Okay. I'm just going to do an assessment of your pulse here, okay? And just feel your pulse. Okay, excellent. Thanks for that. I'm just going to write a few of these things down so I don't forget them.
Okay, thank you.
Alright, so your pulse is 64, so I'm pretty happy with that at this stage, alright? Now the next thing I want to do is just have a listen to your lungs, make sure your lungs are all good. Have you had any trouble with your breathing at all?
No, nothing with my breathing.
Okay, fantastic. So, just to demonstrate, listen to your lungs and listen to all 4 lung fields over here. I normally get you to lift your shirt up for me, okay? So we'll just take some deep breaths. And another couple of deep breaths there. Couple more deep breaths there. And 2 more deep breaths. Okay. Very good. Your lung sounds are nice and clear.
Yeah.
All right. Now, just going to also just breathe normally for me, Jess. Okay. As we do that, I'm just going to feel for this. Yeah. Okay, very good. I'm pretty happy with how you're breathing and everything. Like your lung sounds are really good. Your respiratory rate is totally fine.
Okay.
And everything like that. Just because you had a fall, you don't really remember what's happened and everything like that. I just want to do a quick assessment on you about stroke. Okay.
Yeah, that's okay.
So just smile for me. Show me your teeth. Okay. Poke your tongue out and move it side to side. All right. Very good. Can you squish your face up for me, really nice and tight? That's excellent. Now, can I just have your hands? Now just squeeze my hands as tight as you can. Really good. Now pull back towards you and pull out and push out towards me. Alright, very good. Now I just want you to hold your arms out like this. Close your eyes. Turn your palms up into the sky. And I want you to hold your arms out in the air until I tell you to stop, alright?
Okay.
Alright, that's really good. You can lower
Thank
your
you.
hands now. Alright, lift this leg up for me against my hand, and lift this leg up for me against my hand. Okay. Do you feel any weakness in any part of your
No.
body at all?
No,
Alright,
nothing at all.
fantastic. That's really good. So that's just a little stroke assessment that we do, just to check to see if there's any sort of evidence of a stroke or anything like that. Just going to shine a little light in your eyes. Just look, yeah, perfect. Thanks. Just look at my nose. All right. Okay, fantastic. And I'm just going to move. I want you to just follow my fingers with your eyes and not with your head. Okay. So side to side. That's perfect. Up and down. Excellent. Okay. Can you touch my finger with your hand and then touch your nose? So my finger, your nose. Yep. And with the other hand. Perfect. All right. That's excellent. And count to 10 for me.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay. Excellent. Jess, have you ever had a seizure or anything like that
No.
before? Okay. All right. So you never had a seizure.
Never had a seizure.
And you never had a stroke or anything like
No,
that? All right.
nothing at all.
Do you have any other medical conditions or anything?
No, I don't take any meds. My period is a little bit late.
Okay.
There's the chance I could be pregnant. However, I'm not. I'm thinking I'm not though.
So there is a chance that you might be pregnant.
Could be,
Okay.
but
All right.
very unlikely.
All right. And so you said you're a little bit late. How late?
2 days.
You are? All right.
Yeah.
Now, have you ever had any episodes like this before, where you sort of blacked out and
No,
anything like that?
never.
Right. And you've been pregnant before?
No.
No. Okay. So potentially this could be your first pregnancy. So you're sort of going, delving into the unknown
Yeah.
a little bit.
Yeah.
Okay. Do you have diabetes?
No.
No. Okay. Have any issues with blood pressure?
No. Nothing at all.
Do you get frequent headaches at all?
No.
No. Okay. All right. Now I just want to do a few little tests. These are just very basic tests. All right.
Okay.
This one just checks your oxygen levels and your heart rate. Okay.
Yep.
And both of those look really good, and they correlate with what I've had a look at
Yep.
already. I'm just going to check your blood pressure, and then what I'd like to do after that
Yeah.
is have a look at your heart, do an ECG
Okay.
on your heart, and then we might actually see how you go assessing your walking, how you get around the
Okay.
house, and then we'll go from there.
Yep.
All right.
Okay.
I'd probably also like to just check your blood pressure
Yeah,
while
that's
you're
okay.
while you're sitting,
Yep.
and then I'll do it when you're standing up as well.
Okay.
And that'll just determine if there's any changes
Yeah,
that are
okay.
concerning to us. Okay. Now, have you had any pain in your chest at all?
No, nothing at all.
All right, fantastic. So your blood pressure is a little bit on the lower side at this
Okay.
stage. It's
Yep.
95 over 60.
Yeah.
And so what I'd like to do in a minute is we'll get
Yep.
you to stand up.
Okay.
We'll see if there's any changes in your blood pressure.
Yep,
You're not
okay.
feeling dizzy or lightheaded right
No,
now?
no.
Okay.
I feel alright now.
Alright. And your heart rate's not overly fast, so it doesn't look
Okay.
like your body's compensating for that blood pressure.
Yep.
Have you ever been told that you have low blood pressure at all?
No.
No? Okay. Fair enough. So it sounds like you're normally pretty fit and healthy then.
I've been under like a little bit of stress of late. I've been away
Okay.
from my family.
Yeah.
I've been away for work, so
Yeah, right, yeah.
otherwise that's probably the only real thing I can think of.
Has there been any change in your eating habits or anything like that?
I've had a bit of a I'm not eating as but drinking also. I've had a bit of a decrease in my drinking fluids.
Okay.
Maybe food. Yeah.
Yeah.
Yeah, but more so fluid wise.
So not drinking as much fluid?
Yeah. Not as
Drinking
much
any
as-
more alcohol than normal?
No.
Okay.
No.
Alright. So this test is just a blood sugar level test,
Okay.
okay? Now, we'll, it just checks the sugar level in your blood,
Yeah.
and just determine sort of, that we want to look
Yep.
at for a normal level between sort of 4 and 9 ideally
Okay.
for normal people. So just borrow a finger there, alright, we'll sting, take a drop of blood, and let's see what we're looking at there, okay? Alright, so your blood sugar is 3.9.
Okay.
It's sort of on the lower side of normal.
Yeah.
I mean, like very just below normal.
Yeah.
So I'd probably like to see a little bit more than
Okay.
that. Have you had anything to eat or drink today?
Oh, earlier I had a cup of coffee.
So you've only had a cup of
Yeah.
coffee today, and it's
Yeah.
sort of like, I mean, it's quite late at night. At night in this stage. So, I think that you probably need to eat a little bit more through the
Yeah,
day. You know,
okay.
you're obviously under a lot of stress.
Yeah.
You're not drinking a lot of fluids, and you're not eating as much food as
Yeah.
as you really should, to be honest.
Okay.
So it sounds like you probably need to have something to eat, because
Yeah.
potentially that could be a cause for why
Okay.
you're feeling the way you're feeling. I'm just going to check your temperature in your ear. All right, so you don't have a fever or anything.
Okay.
Have you had any fevers lately at all?
No, nothing at all.
Okay, no fevers. Any exposure to anybody that's been unwell?
No.
No. And no exposure to anyone that's had COVID?
No.
No. Have you had any other COVID symptoms, like any coughs or runny nose, sore throat, any unexplained headaches
No.
or anything like that?
No.
Okay, very good. All right, all that looks really good.
Okay.
What I'd like you to do is, if
Yep.
you're happy to, we'll stand
Yep.
up. If you feel like you can't stay standing, I just want you to sit straight back
Okay.
down for me, okay?
Yep.
Because we just have to wait about 30 seconds.
Okay.
I'll check your blood pressure,
Yep.
and then we'll sit you back down. Okay? Just keep an eye on that one here. How do you feel? You feel a bit dizzy?
I feel a little bit lightheaded.
A little bit lightheaded?
Yeah.
Alright, just have a seat back down for me.
Thank you.
Blood pressure has dropped a little bit.
Okay.
We're talking about 80 over 55.
Okay.
So it's not dangerously so. It's, we'll check it again,
Yeah.
in a couple of minutes,
Okay.
just to make sure it's sort of come back up.
Yeah.
But obviously you've got a little bit of a drop in your blood pressure
Okay.
from sitting to standing.
Yeah.
There's clearly a cause for that, and
Okay.
and so we'll have a look at that further.
Yeah.
The
Okay.
next test I want to do is just an ECG
Yep.
on your heart, if that's okay.
Yep, that's fine.
I'll just rest this here.
Yep.
We'll come over here and do our ECG on the mannequin. So this just checks for any sort of changes in your heart rhythm or
Okay.
anything like that. Okay. Have you got any questions at this stage, Jess?
No,
Okay.
nothing at all.
Alright.
That I can think of.
Yeah, excellent. Alright, so these ones are going to go up on your shoulders and on your sides here. I'll just put them on your deltoids instead. Now I'm just going to have to press on your chest here a little
Yep.
bit just to find a few things, a few landmarks for me. All right. So, oops. All right. What's your last name, Jess?
Townsend.
All right. So it's TAWNSEND.
NSEND.
And it's Jessica.
Yes.
Okay. And about what time did this happen? How long ago?
What's the time now?
It's about 9:30 now.
So it would have been probably about 9 o'clock.
9 o'clock. Okay.
Yeah.
And you're 24 years old. That's right.
Correct.
Yeah. Okay. No worries. Right. I'm just gonna have a read of this. Just stay nice and still for me while we're there. All right. All right. Let's have a look at this. All right, Jess. So at this stage, it's not coming up showing that you're
Yep.
having any problems with your heart or anything
Okay.
like that. So I'm really happy with that.
Yep.
I'm going to take all of these leads
Yep.
off, okay, and we'll pack that away. A couple more things that we'll do is I'll check your blood pressure again, and then we will go from there with some treatment plan, okay?
Thank you.
Alright, so let's check your blood pressure again one more
Yep.
time. I might just get you up and see how you go with walking,
Yep.
just to make sure I won't make you
Okay.
walk for too long, and
Yep.
then we'll get you laying down on the, when we get you in the stretcher, okay? Okay, very good. Your blood pressure's come back up to 100
Okay.
over 65, so that's really good. Alright, I'm going to take that off. Now, before we get walking, do you take any medications for anything at all?
No, nothing
No.
at all.
Okay, very good. And you have any allergies to any medications? No, no allergies. So, really quite a simple case, really. I'm a little bit concerned that you've got what we call postural hypotension,
okay.
which just means that your blood pressure drops when you go from a sitting to a standing position,
Yeah. Okay.
and your heart rate sort of compensates a little bit by going up a little bit.
Yeah.
The cause for that could be a myriad of reasons.
Yeah.
And for someone as young as you, and pretty fit and healthy and all
Yeah.
that sort of stuff, we're not really sure. My plan will be, I'd like to put a cannula in,
Yeah.
just give you some fluids, so
Okay.
we can sort of give you a little bit of volume management for
Yeah.
your fluid volume, because it doesn't sound like you're getting enough fluids in.
Okay.
And we'll probably try and get you lying down on a stretcher, and then
Yeah.
just take you out to hospital for
Okay.
some more tests, and then they'll be able to determine what you need from there.
Yeah.
You're probably better off having something to eat or drink as well,
Okay.
just because your blood sugar is a little bit on the lower
Yeah.
side. And so if you've got some orange juice or something like that to just have
Yeah.
here, we'll have that. And then maybe a sandwich there as well
Okay.
to sort of sustain that, because I don't think there's going to be any risk of that. You don't have any
Yeah.
nausea or anything
No,
like that right
nothing
now?
like that.
Okay, excellent. Do you have any questions at all?
No, nothing.
Alright, so what we might do is we'll get the stretcher organised,
Yep.
get you on the bed, and we'll get you cannulated
Okay.
and get some fluids going.
Sounds good.